Hi all, you're listening to Discover Your OT Path. My name is Riley Heiser and I'm a student at IU Kokomo, currently enrolled in the Occupational Therapy Assistant program. For my capstone project, I'm creating a podcast to help current students learn about the various settings available to them. Today's setting that we're going to be focused on is skilled nursing. So without further ado, please welcome Christine Davis, who is an OTR.
Hello. Thanks for having me, Riley.
Hello. All right. So before we dive in, can you just tell us a little bit about yourself?
Yeah. So I learned that I wanted to be an OT kind of early on in my life, which was great. So when I was at IUPUI, I did my bachelor's in kinesiology with a minor in psychology. And then I was also like a pre-OT focus. So I took all the prerequisites and everything, which was really nice. And then I went on to get my Master of Science in Occupational Therapy from IU. I graduated in 2015. And then I went directly into working in skilled nursing pretty much from that time on.
And for anybody listening, I get the privilege of having Christine as a professor, so I know that she has lots of great stories, so I'm really excited for this.
Oh boy.
But can you kind of describe like your workplace for us?
Yeah, so clinically, I worked at a skilled nursing facility, the same one from the time I graduated until I went into academia. So for 7 years full time, I worked at a 140-bed skilled nursing facility that had rehab to home as well as long-term care and then a memory care unit. So I got a little bit of everything, which was really great. I was a primary OTR there, and I supervised up to, I think, 4 OTAs at one time. I also covered another building that we had that was about an hour north, and I'd go up there about once a week and then do virtual supervision with an OTA who worked there. I did that about 2 years, right around when COVID hit. Just they were having trouble getting an OT in the building, so that was really nice. And then I also took on doing some managerial stuff, filling in for our manager when they were gone, as well as doing scheduling with PRN staff, as well as just the daily caseload things.
All right, so who all did you work with, like, in your in your field, sorry.
Yeah, so we had a very large team for most of the time that I was there. Typically, if we were fully staffed, we would have 2 evaluating OTs, we would have 2 evaluating PTs, and then we would also have, I want to say 3 full-time OTAs, as well as a couple of part-time or PRN OTAs that would come in and help out. And then we also had 3 PTAs, typically full-time. Currently it's like 2, and then the manager carries like a 50% caseload as a PTA as well right now. And then we have usually 1 to 2 speech-language pathologists on our team. And then we also have gotten to have restorative nursing, which has been really great. They have changed the game in a lot of ways as far as what I can do, and then, kind of collaborating with them has been really nice. So we have a restorative nurse who is in our department, as well as 2 restorative aides that are full-time with us as well.
What exactly is a restorative nurse?
Yeah, so a restorative nurse, typically I believe that they are RNs. I could be wrong on that. Okay. But typically what they do is they focus on kind of bridging the gap between therapy and nursing. So whenever I get ready to discharge someone from OT, I can create this whole restorative nursing program, kind of like active range of motion, strengthening, transfers, ADL, anything like that. And I can help kind of train them or make sure that they know specifically, how this client does it. Maybe they transfer slightly differently than what you would normally expect. So I can pass on kind of that skilled knowledge that I've had from working with them in OT I can pass that on then to the restorative nurse, who would then train the restorative aides, and then they would take over seeing the person for like, I don't know, usually a month to 3 months, and then they would start training the floor staff. So there's a lot better carryover because you have someone who speaks like that nursing lingo, right?
Yeah.
So educating the floor staff goes a little bit easier that way, and then it's not solely out of the skilled OT time.
That sounds really helpful, actually.
It is. They also work with new admits too, which is really cool. So sometimes, like, if somebody's really having a lot of trouble, let's say with, like, they're just really weak in general, they have low activity tolerance, they have a lot going on medically, they also, like, need a lot of help with ADLs and walking and all these things. It's just someone else who can go in there and they can do some of the lesser, I don't want to say lesser skilled, but maybe the things that I don't have time to get to, right? Like, where I can focus my time more intently on things that I need to, and they can kind of help well round the person.
Do you think that these are like common in skilled nursing facilities, or is it like new and upcoming?
It kind of ebbs and flows based on, I would say, like, reimbursement culture, kind of.
Yeah.
Currently, so we did not always have restorative nursing. It used to be there before I started in practice, and then, as you learned in class the other day with reimbursement, we had a nice shift from PPS to PDPM about halfway through my time there. And so restorative nursing has kind of made a comeback, at least in the company I work for, and I think it's been really great. I'm not sure if every skilled nursing has them, but I know a lot of them utilize restorative nursing in that same manner.
Yeah. All right. So how would you say the like energy is like between everybody who works there?
Yeah. I would say we're kind of like a big family, if that makes sense.
I think that makes sense,
Our therapy rehab department, we are always laughing. We always have a good time. We always, kind of keep track of each other and notice if somebody's kind of having an off day. We always try to, pick them up, cheer them up. We have a lot of inside jokes, which is really fun. For example, like, if somebody got called the wrong name by somebody, like, we kind of keep it going.
Yeah.
And just kind of joke around that way. It's an easy way to put smiles on everybody's faces. And I'd say, like, these are the people that kind of walk through the same thing that you are. So if you're having a bad day, it's likely that somebody else has kind of experienced the same tough situation maybe that you're dealing with. So it's kind of nice to rely on those people in that way too, where you can kind of, I guess everybody's kind of open to talking about, like, what's been tough for them or how they got through it. So that's always been nice. I mean, obviously there's bickering and things like that normally happens, right? But I would say in general, we just work as such a great team, and I think the team environment has a lot to do with the success that we've been able to have as a therapy department.
Yeah. Well, and then with you being an OT and being, like, overseeing OTAs, what is, like, a recommendation that you would have for an OTA that is going to be overseen by an OT that maybe they don't get along with, or, like, they don't feel heard? Like, what would you do? Like, how would you... I don't really know how to exactly ask this.
Yeah, and it's hard too, because especially in a skilled nursing, like, you might have two supervising OTs that, their caseload kind of gets split out to you as an OTA. And so I've seen that because, typically there will be multiple OTRs, and then we have multiple OTAs that we work with as well. So my caseload will typically get split up. Like, I think at the max I had like between 40 to 60 people just on my caseload that I would then split out to other people to see them daily. And it gets kind of hard whenever you're thinking about documentation or the way some people like to have things done. And I would just say communication, using that therapeutic use of self in this situation as well, thinking about those different interpersonal dynamics and how you can show, I want to say, like respect, but also get your point across and advocate for yourself.
Yeah.
So I found that if, from an OTR standpoint, right, if I have somebody that maybe is struggling with their documentation to be where I would like it to be, I typically go to the other OT and I say, hey, what are you expecting? Is there a way that we can kind of get on the same page? And then we might, come up with an agreement together. And if there's an OTA that I'm working with that maybe they're, not doing a treatment in the same way I would like, or they're not using a technique in the way I would like, I would just have a conversation on the side and just say, hey, this is the way, like, research has shown this, or, is there a reason that you're doing this way? Like, was there something that the client said that kind of led you that way? Just try to collaboratively work through, any issues like that. I think communication is the biggest thing, and having that approach of how can we work together and not I want to do it my way just because I do.
Yeah.
If that makes sense.
Yeah.
Yeah.
So obviously hearing you talk about your job, you sound like you absolutely love it, but
Oh, yes.
Unfortunately every setting can't be perfect. So what are some of the biggest challenges that you faced in this setting?
Oof. That's really hard. It kind of ebbs and flows. Like, it depends on, I'd say, when you ask me. In general, I'd say productivity in skilled nursing is usually really high. So I know some companies are like 92 to 95% for OTA productivity, which is really hard to meet.
Yeah.
With current demands and the current caseloads that people are seeing. OTRs, like, were between 80 to 87% productive. That's also really hard when you think of the amount of documentation that skilled nursing typically requires.
Yeah.
So I would say that's really hard, as well as, like, all the changes with reimbursement and Medicare. Those are big challenges that I have. And then also, I'd say, like, staffing turnover and burnout.
Yeah.
It's been really hard the last few years on really everybody in healthcare, and skilled nursing's no different. I mean, we've had agency come in and out with nursing. We've had a lot of turnover with, like, building administration and directors of nursing. And all of those changes kind of impact the overall vibe that's going on.
Yeah.
In a facility. If your leadership is constantly changing, or everybody's idea of what should be done is consistently changing, it's hard to make a lot of progress and to really have consistent care for your clients.
Yeah.
So I think that's kind of hard. And then also, just, it took me a very long time to find my voice and advocate for the OT profession and showing them research, right? Like, OT is really important in fall prevention. Here's this research that is backed up by it, right?
Yeah.
This person's sliding out of their chair. Well, maybe an OT referral would be great to take a look at that wheelchair and say, how can we position them differently? Or what is the reason for this? Kind of finding those root causes. It's really important. And then also just advocating for preventative measures. So trying to get people to allow you to do quarterly assessments, or check on your long-term residents a little bit more and spend time with them so that you can prevent them from having a fall, prevent skin breakdown, prevent them having to go to the hospital for something. If you can catch something early because you're doing assessments and you're checking on them, that's huge.
Yeah.
So I'd say those are my
Yeah.
things. Yeah.
Is there anything that you do that helps make maybe harder days a little easier?
Definitely. I definitely try to, anytime that I've had, a difficult session, or I'm being hard on myself, or, you know, maybe somebody was having a bad day, maybe not even a client, just somebody in the building was having a bad day or something like that. I have some key people that I talk to, and I'll go to my team and I'll just say, hey, I don't know what's going on, but I just need a minute to like hang out here and just be around, this energy that is fun. And, a lot of times that's in the therapy room where, people are just having a good time and telling jokes and, getting to chat with other residents who are down there. Maybe seeing, like, waving hi to one of your, people that you've worked with for a really long time.
Yeah.
And checking in on them. Those things are always fun. And they kind of help ground you into what's important.
Yeah.
And maybe letting go of what's not. So I'd say a distraction technique is helpful.
All right. We're going to take a little break from the interview, and I'm going to ask an NBCOT question. An 82-year-old client with mild cognitive impairment lives alone and was recently hospitalized due to mismanaging medications. The client reports sometimes forgetting doses and occasionally taking a second dose just to be safe. The client wants to remain independent at home. What is the most appropriate initial intervention by the occupational therapist? A. Recommend that a family member take over full medication management. B. Provide education on the importance of taking medications as prescribed. C. Assess the client's routines and implement a pill organizer with visual reminders. Or D. Request the physician discontinue medications that are difficult to manage. And the correct answer is C. C is correct because assessing habits, routines, and introducing environmental supports like pill organizers, alarms, and a written schedule promotes safe independence while addressing the performance deficit. A is more restrictive and removes independence prematurely. B is not correct because education alone is insignificant when memory deficits are present. And D is not correct because medication changes are outside the OT scope of practice. And now we'll get back to the interview. Opposite end, what do you absolutely love about this setting?
Oh, I love my clients. I really do. It's frustrating sometimes. It's like trying to sell someone on, disrupting their daily routine, or like they've just come from the hospital and they're just so exhausted. And they're like, why do you want me to get up and go to the bathroom? Why do you, just trying to sell them on it. As hard as that can be, I just love them. Every single person, and I know we talk about this in class too, but every single person has had a whole life, before they get there. And I think it is so interesting to get to know people and to get to work with them and walk through this journey with them. I think it is so cool to get to know something and then be able to go and brighten their day later, and just kind of bring up that topic to them again. Maybe they were telling you about their grandkid and how their grandkid is getting married and all these things, and then you get to go back, you go back the next week and you see them again and you get to say, oh, how's such and such doing? And they just get this smile on their face that somebody listened. And I just love that I get to spend, kind of one-on-one time with them and really get to enjoy that time and be productive and help them and, make them more independent, or at least comfortable, depending on what we're doing,
Yeah.
Because especially, you guys know that social isolation is really rough in this population. Mm-hmm. And if I can be a little, bright spot in their day, or help them with something, even if it's just getting them water, that's worth it to me. So
yeah. What is something that people on the outside might not expect when working in this profession?
Like when working in OT in general or in skilled nursing?
I guess you could do either.
Okay. Maybe we'll do OT first.
Okay.
I just don't think people realize like how impactful it can be. I don't think people take credit enough for what they do, right? Because a lot of the things that we're trained in doing are either second nature or they become second nature to us. So just keeping in mind, this is a skill. Like what we're doing, we're looking at these activities, we're breaking it down, we're coming up with modifications, we're coming up with different ways to help people and being creative. Like that is a skill, and that is huge. And a lot of people aren't able to really think in that way. And so I think just keeping that in mind, that as OT practitioners, we have a wonderful skill set that's very distinct, and it's important to utilize it.
Beautiful.
Do you want to know about
skilled nursing? Yes, please.
Okay. So for skilled nursing, I would say, and I didn't know this until I had a level 2 field work in a very similar setting. And I apologize if I've told you this before. But I did not realize that skilled nursing could be more than just like, excuse my language for lack of better terms, more than just, a 20-bed retirement facility, or, those like, as they used to call them, like old folks homes, right?
Yeah.
Like I did not know. I was not aware of the vastness of difference between different skilled nursing facilities. And there's nothing wrong with the other. Like I have been to those and I really enjoy them as well. But for me, what sold me on skilled nursing was going to a place where I had those 3 different kind of settings all in one.
Yeah.
And I got to really challenge myself. So having somebody that maybe was at the hospital and they just had a stroke and they're in an acute recovery phase, right? And I'm doing neuromuscular re-education. I'm doing like all these different techniques and just really working on that skill set of mine. And then my next person is a long-term care resident, and I'm helping them with fall prevention. I'm helping them think of different room modifications to help them be able to access their bathroom better, things like that. Or then I go to the memory care unit next, and I'm helping somebody with feeding that has, dementia, something like that, or wheelchair positioning. I think a lot of people don't realize that skilled nursings are not all created equal either, in terms of, your team, what kind of cases you might encounter, things like that. I had no idea that I would be doing wheelchair assessments, power wheelchair assessments, that I'd be doing splinting, I'd be doing orthotic management, even if they're prefabs, or even creating my own. I did not realize that I'd be doing all of that, and all the physical agent modalities. It was just such a wide variety, and I just feel like I always learn something new with each client I work with, and I never get bored. That's the nice thing.
That's good.
Yeah.
So for any student or listener who might be considering a similar career or work environment, what kind of person do you think thrives here? So if you could choose 3 traits that you think would really fit here, what would those 3 traits be?
Can I choose 4?
I mean, if you would like, yeah.
Okay. I would say that somebody has to be very adaptable. They need to be client-centered. They need to be very truthful.
Yes.
I would say. And then they also need to be resilient. Because like I said, it is you need all of those things.
Yeah.
I would say. And if you don't have them, like, work on them, right?
Yeah.
But those are the things that I really feel like I had to work on in myself. I used to be very, I don't want to say type A, but kind of type A about certain things. And working in this environment really challenged me to be more flexible and adaptable and just kind of, I don't want to say go with the flow, but it helped me grow in that way.
Yeah.
And allow me to. So that was nice. And then also just being resilient. I can remember multiple times where I got fired by a patient because, maybe I didn't do what they wanted, or one lady confused me with someone else, and that was okay. But I just remember crying.
Yeah, I didn't even know I didn't even know a patient could fire you. So I'm a little scared now for my placement, but
You'll be great. It was such a shock, and nobody prepared me for that. And luckily I had a great manager and a great mentor, and they were like, it's gonna be okay.
Yeah.
People don't have to always like you. You're doing the right thing, and as long as you do the right thing, that's all that really matters. Obviously help them.
Yeah.
You know what I mean? Like, if you're doing the right thing and somebody gets upset with you about whatever, that's not really on you. So being resilient and going back and trying again and working with those people, even if they've yelled at you or cussed at you or, not necessarily had the best interaction with you, being resilient in that way, and also advocating, advocate for yourself, advocate for your client. If you're being client-centered and you're doing the right thing, that's all you can do.
Yeah.
Yeah.
So before we finish up here today, is there anything else that you'd like to share about your work setting, or just any experience you've had?
I think we kind of touched on it, but like, it is hard to get buy-in, especially with some of our older adult population. Obviously skilled nursing, like, does not only cover older adults. That's kind of a misconception, but there are some younger folks in there. But I would say also just, in working with an older adult population, right, like, it is hard to get buy-in and help them figure out, occupational therapy does not have our name isn't as recognizable as in some other professions. And so having a really good elevator speech, using your therapeutic use of self, and creating that buy-in. So that manager I was telling you about used to say that they could sell a ketchup popsicle to a lady with white gloves. And they'd be happy about it,
Yeah.
So that was kind of always the saying, like, in therapy, you just have to sell, and you got to sell yourself. You got to sell what you're doing. You have to get buy-in, because if you don't have buy-in from the person that you're working with, the progress isn't going to be nearly what you need or would like to see them get to. And they're not going to be super happy either. So, I would just say, having those tools and using all of your tools is really important to get that buy-in, and therapeutic use of self is the best thing I've found. So,
well, thank you. Thank you so much, Christine, for letting us know all about working in skilled nursing. We really appreciate you being here.
Thank you, Riley.
Thank you to everyone for listening. Be sure to follow along for the next episode, where we will be diving into outpatient pediatrics.